Welcome once again. We are going to talk about brain trauma with respect to 4 different aspects in the forthcoming sessions. In the present session and the forthcoming session, we will discuss about 4 aspects. We will talk about injuries, we will talk about stroke in one session, and we will talk about tumors in infections in another session. Now, brain injuries, tumors and infections can cause dementia and other serious and chronic conditions. Damage to the brain is of central importance in influencing how a person functions. Traumatic brain injury is an injury to the brain as a result of jarring, bruising or cutting. Traumatic brain injury is a common cause of many mental disorders. This can have huge consequences. Major brain injuries can have profound cognitive as well as behavioral consequences. The more serious cases lapse into persistent vegetative state or even develop epilepsy. Majority of traumatic brain injuries, however, are classified as mild. As you are seeing here, the common symptoms, as I have told you already, include fatigue and poor attention and concentration. Here you see the girl complaining about her headaches and not being able to attend properly, and then also reporting about emotional ups and downs. You also see here a state of confusion in the individual as a result of the injury, traumatic brain injury. He is in a state of confusion. He is not able to understand what is happening. While many are classified as mild, a small percentage of individuals who sustain this mild traumatic brain injury suffer long-term disability. They may have difficulties in a number of areas of functioning, including work, school, leisure activities, and may show extreme personality changes as well. Common symptoms usually following a mild traumatic brain injury include fatigue, sleep disturbances, poor attention and concentration, slowed reactions, delayed reactions, emotional ups and downs, and social and moral failures such as selfishness, callousness, which is exhibited in their behavior. They do not look disabled, and partly for that reason they often receive little understanding, let alone adequate treatment. Remember that we are talking about mild injury. But many of them are even unable to lead normal lives. This is because they are not adequately treated. They are not adequately given importance to. In many cases, it is difficult to determine how much of the abnormal behavior is a result of the damage and how much represents a lifelong behavior pattern or simply a reaction to the knowledge of the injury. In fact, these factors can interact in a variety of ways. A startling or traumatic event, whether or not it involves physical injury, usually has some specific symbolic significance for the individual. The term traumatic neurosis has been used to describe reactions that follow such an event. A blow to the head that caused little physical damage might be exploited by the injured person, like in some hysterical disorders. The reaction may be reinforced by secondary factors like sympathy from one's family or permission to quit one's job. Head injuries can lead to highly specific losses in motor or cognitive functioning, with the extent of the loss depending upon the kind of injury and also where it is located, the location of the injury. As we said, several traumatic events which may or may not involve physical injury can be the sources of the problem. Like for example, here you see in the boxing ring, when there are repeated strokes, when there are repeated punches which are aimed at the head and the facial zone and especially at the head, what happens is there may be a resultant injury. And when this happens repeatedly, you can see that there may be a pressure which may be applied around in various ways due to the punches, which may result in the injury. And the result may be, even if it is temporary, a loss of consciousness, as we are seeing in this picture in the boxing ring, the boxer losing consciousness, even if it is temporary. And here you see the severe injury which the person has faced. Look at the helmet being dropped, look at the head being injured, This may result in certain problems and certain reactions, and this is where we talk about traumatic neurosis very often because of the physical damage which the person has faced to the head. Traumatic brain injury can be subdivided into three categories: concussion, contusion and penetrating head injury generally. Let us first talk about concussion. The blow to an individual's head jars the brain, momentarily disrupting its functioning when there is a concussion. Please look at this picture. It can be a blow somewhere to the head, or the head may strike a hard object, and this can create a concussion type injury. You see how in the second part of this slide, how the head has been injured. The blow to the head has jarred the brain in such a way. You see the arrows which are pointing out in the mutually opposite directions in the first picture and as well as in the second picture. You see how the brain can be jarred as a result of severe injury or severe blow to the head. It can be by a accident, it can be by a blow, by a punch, which we have been talking about in the boxing rings, or it can be a motorcycle accident. It can be in any of these conditions. The usual result is a temporary loss of consciousness, often lasting for only a few seconds or minutes, after which the person is typically unable to remember the events immediately preceding the injury. Let us talk about the second aspect, that is contusion. In a contusion, the trauma is severe enough that the brain is not just jarred, it is actually bruised. You see over here in the picture that there is a blow to the head, and as a result of what they call the coup, the blow, there is a, you see the rotational forces which are related to shearing and twisting, and then what happens is when there are repeated blows or when the blow is severe enough, then there may be a contusion. And there may be a swelling, there may be blood clots. You see bruised part over here, the red part over here marked in red. It is indicated by arrows on both the sides. And here it is very clearly seen as to how the bruise is. In the second part of the picture, it is very clearly seen how the brain is bruised. This may result in a variety of changes in the behavior as well as in the cognitive angles. And as we discussed, it may even lead to delirium. The person typically lapses into a coma for several hours or even days, and afterward may suffer convulsions and temporary speech loss or convulsions or temporary speech loss. On awakening from coma, contusion victims may fall into a state of disorientation, which is called acute confusional state, in which they may experience hallucinations, delusions, agitation and a host of other cognitive difficulties. These symptoms generally disappear within a week or so, but a very severe contusion or repeated contusions can result in permanent emotional instability and intellectual impairment as well. Again, the length of the period of unconsciousness is useful in predicting the severity and duration of the post-traumatic symptoms which are likely to be seen. The effects of repeated head injuries, such as those suffered by the boxers, can result in cumulative damage. The effects can be manifested years later in terms of dementia pugilistica, better known as punch drunk syndrome, which involves memory lapses, lack of coordination, loss of coordination, dizziness, tremors and or other physical and psychological impairments. The third type is penetrating head injury. A foreign object such as a bullet or a piece of metal enters the skull and directly ruptures and destroys the brain tissue. Here you see a sharp object penetrating into the skull of an individual in the black and white picture that I am showing over here. And look at the second part, an object which has directly penetrated into the brain, into the skull. This penetrating injuries to certain areas of the brain result in death or extreme disability, while damage to other areas may have relatively minor consequences. Normally, a penetrating injury results in physical and cognitive impairment, whether it is major or minor. We have been talking about a variety of head injuries and brain trauma. Let us talk about the risk factors which are there behind this traumatic brain injury that we have been talking about. Traumatic brain injury results principally from motor vehicle accidents, falls, acts of violence, sports injuries and many others. It's more than twice as likely to occur in males compared to females, with the highest risk age group being 15 to 24-year-old. Children and the elderly are also at risk, usually through falls, very young children and older, very senior adults. The most common cause of traumatic brain injury, accounting for more than half of all serious head injuries according to researchers, according to surveys, is automobile and motorcycle accidents. Many of these injuries, isn't it then evident that most of these injuries and many of these injuries could be prevented through the use of seat belts or bags, airbags, infant or child car seats and helmets, and not driving while drinking or under any intoxication? Having talked about the prevention, let us now talk about the treatment of traumatic brain injury. For many patients, head injuries can be devastating. For others, the deficits can be subtle. Often, when the frontal lobes are involved, these patients lose control over their emotions and their ability to behave in a socially appropriate manner is reduced. Depending upon the severity of the injury, then, the rehabilitation of head injury can range from intensive inpatient treatment, including coma management and residential rehabilitation, to periodic outpatient treatment as well. Rehabilitative treatments following traumatic brain injury include restorative training programs which focus upon improving specific cognitive functions like exercises. Rehabilitative treatments following traumatic brain injury involve restorative training programs, specific training programs focused upon improving a specific cognitive function like exercises designed to improve attention, and compensatory training focusing on developing methods to compensate for a specific cognitive impairment. Psychotherapy is important in helping people with traumatic brain injuries. Psychotherapy is important in helping people with traumatic brain injury in order that they adjust to changes in their overall functioning, as well as to treat the depression and anxiety which may be associated with the injury. Medications, of course, are used to treat associated emotional and behavioral disturbances too, depending upon the need. You see that here there is an adolescent who is being helped related to the changes in the overall functioning, and also with respect to psychotherapy can help them in dealing with their depression and anxiety which may be associated with the injury. And you also see a group counseling situation where a group of people who have had similar experiences can help each other. It can be therapeutic in itself with the facilitation of a psychotherapist. Having talked about traumatic brain injury, let us now talk about yet another important aspect, that is cerebrovascular accidents, also called strokes. This is another category of brain disorder which includes disorders due to cerebrovascular accident, in short called as CVA, and it is better known as stroke, in which there is a blockage or breaking of the blood vessels in the brain which results in the injury to the brain tissue. In many cases, occurrence of this CVA, that is cerebrovascular accident, is marked by stroke syndrome, the acute onset of specific disabilities involving central nervous system. The person wakes up from a nap or sits down for dinner, and suddenly he or she no longer can speak, cannot understand speech, cannot move, let us say, the right side of the body or perform another function. Many people have what are called silent strokes. These are small CVAs, cerebrovascular accidents, that occur in less critical regions of the brain, and they have less noticeable effect upon the behavior of an individual, though the person may find that certain functions like memory are gradually eroded. Let us talk about two broad categories of cerebrovascular accidents: infarction and hemorrhage. Let us start off with infarction. In infarction, the supply of blood to the brain is somehow cut off, resulting in the death of brain tissue fed by that source. Here in this picture, you see an area which is marked in blue, which is an area of temporarily blocked blood flow. Why did this happen? You see, in this circle it is explained. Blood clots in the middle of the cerebral artery have blocked the blood flow. So that's how, as you see towards the end of this picture, the blockage in the internal carotid artery has created the problem, wherein the blood flow has been blocked, and this is what is the infarction. The supply of blood to the brain is cut off, resulting in the death of brain tissue fed by that particular source. And the two most common causes of infarction are embolism and thrombosis. In an embolism, a ball of something such as fat or clotted blood breaks off from the side of a blood vessel or in some other way enters the bloodstream and floats upward until it reaches a blood vessel too narrow to let it pass. So, embolism is where a ball of something like fat, air or clotted blood breaks off from the side of a blood vessel or in some other way enters the bloodstream and floats upward till it reaches a blood vessel which is too narrow to let it pass. That is explained over here. You see that there is a blood clot, and then this is the embol as shown in the rectangle which is depicted under embolism. Now what happens is, this is the small rectangle which is shown in the smaller figure, in the total figure, is magnified and it is depicted in the figure beside that to explain to us how the plaque, how the blood clot and how the embol create the damaged area which is marked in black in this figure. At that point, it blocks the vessel, cutting off the blood flow. On the other hand, in a thrombosis, fatty material coating the inside of a blood vessel, as you see in the picture, gradually builds up until it blocks the flow of blood in that vessel. Predictably, these two different causes produce different kinds of onset as well. When a CVA results from embolism, onset is usually sudden with dramatic symptoms like the person may collapse, may suffer seizures, may become paralyzed, and in thrombosis the onset may be more gradual. As you see, the lower part shows us the normal carotid artery and the second part shows the diseased carotid artery. Thrombus in the carotid artery breaks off and travels into the cerebral artery in the brain as depicted in this particular picture. Now what happens is, this thrombus lodges in the cerebral artery causing a stroke. You see a different colored area over here as compared to the other part which is seen. So this is what thrombosis is. Let us now talk about hemorrhage. This is the other major category of cerebrovascular accident where blood vessel in the brain ruptures. As you see in the picture, a blood vessel in the brain ruptures, causing blood to spill out into the brain tissue. And when the hemorrhage occurs inside the brain, it is usually traceable to hypertension. We see in these pictures over here how a thrombotic stroke, an embolic stroke and a cerebral hemorrhage differ from each other. In thrombotic stroke, which is depicted in the first picture, a blood clot or a thrombus, it blocks the flow of blood in the brain as depicted by the arrow over here, and then this makes a particular area deprived of blood, and that is how a thrombotic stroke results. On the other hand, in an embolic stroke, there may be a fatty plaque or air or blood clot which create the embolism, which breaks away and floats to the brain as indicated by the arrow over here, where it blocks an artery, and when it does, then as shown in this picture, there is an area which is deprived of blood which results in embolic stroke. And we are seeing here a picture where cerebral hemorrhage is depicted. You see that as the arrows indicate over here, there is a break in the blood vessel which is called aneurysm, which leads to the brain, and when there is red area depicts the area of bleeding, and when there is this bleeding, there is an internal cerebral hemorrhage, which once again leads to the injury which we have been talking about. Let us now talk about the effects of this stroke that we have been talking so far. The after effects of a stroke depend upon the nature of the stroke. Is it an infarction, or is it a hemorrhage? Is it embolism or thrombosis? Hemorrhage within or around the brain, together with the extent of the damage and above all the location of the damage. All these determine the after effects of stroke. The most common effects are aphasia, agnosia, apraxia and paralysis. Paralysis of usually one limb or one half of the body, because the stroke occurs in one brain hemisphere. Of all forms of stroke, the most common is infarction due to thrombosis, usually in the left middle cerebral artery. Because the left hemisphere of the brain regulates language, aphasia is very common effect of stroke. And because most people are right-handed and the left side of the brain controls the right side of the body, many stroke patients suffer motor impairments in their dominant hand or leg. These disabilities, whether they result from CVAs or from any other organic brain disorder, are usually accompanied by some degree of emotional disturbance, partly the result of injury and partly a psychological response to the new impairment like depression and emotional lability, where the patient may pass from laughing to weeping in an instant. The response depends greatly upon the pre-morbid personality of the individual. The symptomatology is the result not just of a specific disorder in a specific part of the brain, but also of this disorder's interaction with specific personality features. Let us also talk about the risk factors associated with CVA, that is cerebrovascular accidents. The clearest risk factor for CVA is age. Between the ages of 60 and 80, the risk increases almost 8-fold. In people over 75, the rate of first stroke is almost 20 times that of the general population comparatively. This is because the incidence of physical conditions that weaken the blood vessels, and above all hypertension, heart disease and atherosclerosis or thickening of the walls of the blood vessels increases with age. Another risk factor is gender. Men are more vulnerable than women. The women's advantage is due in part to the fact that estrogen seems to protect against atherosclerosis that we have just described. But even after menopause, when estrogen levels fall, women are still somewhat less susceptible to strokes. That's an interesting aspect. Other high risk groups are diabetics, people with a family history of strokes. High cholesterol and obesity increase stroke risk, smoking almost doubles it, and hypertension increases it 2 to 5 times. Now, understandably, once again, all these factors can be controlled. People often ignore that these factors can be prevented, and hence so many CVAs that we see. Now, having spoken about the prevention, let us now talk about the treatment of stroke. People often ignore the first signs of stroke: lack of awareness, a tingling or weakness on one side of the body, a drooping face, difficulty understanding or expressing oneself. All these can be signs of stroke. Seeking treatment at the first appearance of such symptoms is very important. Medications have been developed that can limit the effects of a stroke, and if they are provided, they are administered in a timely manner.